Kia ora koutou, and welcome to Goodfellow podcast. I'm Dr. Louise Kugler, a GP specialist, and today I welcome to the podcast Dr. Jenny Visser to discuss safe travel for pregnant globetrotters. Jenny is the lead academic for travel medicine postgraduate studies and a senior lecturer at the Department of Primary Healthcare and General Practice, the University of Otago in Wellington. Her research interests include the travel health needs of long-term expatriates and expedition medicine. She also works part-time in clinical travel medicine in Wellington and has travelled extensively herself. Kia ora, Jenny, and welcome to the podcast.
Kia ora, thanks for having me.
So we're going to discuss a case. Sally is a 28-year-old woman who is 12 weeks pregnant. She visits your primary care clinic for a pre-travel consultation. She plans to travel in her second trimester to a third world country, a trip she feels she won't be able to make for several years after her baby is born, so wants to go now. So, Jenny, what information do we need about Sally and her proposed travel itinerary to make sure that she's safe?
I would approach her much the same as I would all travellers, which is, first of all, I split the information I need into what information do I need about the person and what information do I need to know about the trip. Now, in this case, the person, it's all the regular stuff like, have they travelled before? Do they have any ongoing medical conditions, any medications, allergies, all those sorts of things. But obviously, I need to know a lot more also about the pregnancy itself. So second trimester, how is this pregnancy progressing? Is this a normal pregnancy? Presumably, by now she would have had all her normal antenatal screening and we'd be quite reassured that this is a low-risk pregnancy, but really important that we sort that out. And obviously, singleton pregnancies will be much lower risk than twins or multiple pregnancies. So that's all the things I'd need to know about the person, but also about the pregnancy. And then I need to know exactly where they're going and what they're planning to do. And to do that, I find it easiest to always start with, so you're leaving New Zealand and where do you fly to? And how many days are you spending there? And then how many days are you spending there? So that you can build up a really good picture while you're making your consultation or just gathering your information early on in the consultation. So you can draw a bit of a picture in your mind of exactly where they're going and how long and what activities they're going to be undertaking while they're there.
Are there any contraindications to travel in pregnancy? And I always think absolute and relative contraindications.
Yeah. The most important message I always like to get across to pregnant travellers is if you are pregnant, by definition, you are immunosuppressed to some extent. That is just a normal state of pregnancy. And if you're traveling, therefore, any travel will expose you to some infection, whether it's increased exposure to influenza or COVID on the departure lounge where you've got all those people milling around, coughing and spluttering all over you, through to tropical diseases like malaria or Zika or chikungunya or dengue, all of those infections, skin infections, chest infections, traveller's diarrhea, all of those things. As a pregnant traveller, you are going to be at a higher risk of potentially catching any of those diseases, but also of having more severe outcomes if you do catch them. So none of that makes it an absolute contraindication to travel, but it's something that people don't always think about. So it does mean travel to tropical countries or lower income countries is possibly a bit of a higher risk. So it would be not necessarily even a precaution, but it's still something that you need to think about. I think the one disease or two diseases, but one in particular, that you'd really have to think long and hard about is how can you justify traveling into a malaria endemic zone while pregnant? Because we know that even if you are super, super cautious avoiding mosquito bites, even if you take malaria chemoprophylaxis, that is not a guarantee that you will not contract malaria. And we know that malaria naive persons traveling into a malaria region are more likely to get malaria. If you're pregnant, you're more likely to contract malaria. And if you contract malaria during pregnancy, you're at much higher risks of getting very sick with it, and there's a much higher risk of a miscarriage as well. So it's something I caution my travellers about in great detail. The other disease, of course, is Zika. And I think after the big outbreak in South America about 10 years ago or so now, I think there's a lot more awareness around this, but you certainly wouldn't want to be knowingly travelling into an area with a Zika outbreak while pregnant. And while we know the risk of those congenital abnormalities associated with Zika are much higher if the Zika is contracted in the first trimester, there have been cases where people living in endemic areas where we can't pinpoint exactly when in their pregnancy they were infected, but some we have to assume have been infected in other trimesters. So it's just not worth the risk. But those greater infectious diseases risks, there's also, we do know when pregnant, you're at a higher risk of deep vein thrombosis, and some people will have increased risk anyway of travel-related deep vein thrombosis. So that's something else you need to take into account. Also may be less able to tolerate extremes of heat, particularly. You don't want to overcook the baby, as it were. And there are certain activities. Scuba diving, obviously, is out while pregnant. And I think we may talk a little bit more later, but around travel to altitude, there are some precautions there as well. So it depends very much on where the traveller is planning to go and what activities they're planning to undertake. And of course, it's not just that also, is this a high risk or what we call a precious pregnancy? Now, every pregnancy really is very precious, but certainly if it's already a known higher risk pregnancy, then you'd want to be that much more cautious as well.
Some wonderful points here. Thank you. So what advice should we give Sally when planning emergency care whilst she's away, should something go wrong?
Yeah, and I think that brings up another really valid point, and that is all travellers should, I believe, get adequate travel insurance. So the first thing, very important before she travels, is Sally needs to make sure that pregnancy-related emergencies or complications are covered by her travel insurance policy. Most will, but you need to just check that. None of them will cover routine antenatal care. That's something that you have to cover yourself, but hopefully you'll plan your trips so that you won't need to have any routine checks and things while you're away. And I think the other point about insurance that is important, particularly if you're traveling later in the pregnancy, if you were to have go into labour early and deliver while you're traveling, will the travel insurance cover the neonate and the care for the neonate as well? Do a little bit of homework beforehand, thinking about where are the main hospitals close by, what's the emergency number in the country that you're in, what primary, secondary and tertiary services are available locally. And I suppose just going over with the traveller what some of the more common problems that they should seek care for. And we always tell travellers that if they have a high fever and they're not feeling well, they should seek medical care in country. And that's even more important for the pregnant traveller. Or obviously, if there's any obvious concerns with the pregnancy, then they should seek care immediately as well.
Thank you, Jenny. I wonder if we can discuss vaccinations for a moment. And obviously that depends on the country and the region within the country that the woman is visiting. So what are your general thoughts on immunisations for pregnant travellers?
I think the most important point around vaccinations and immunisations while pregnant is because you're immunosuppressed when pregnant. We know from a number of studies that the immune response to vaccines is not as good if you're vaccinated during pregnancy than you would be if you're vaccinated while you're not pregnant. It doesn't mean it's not safe to necessarily to give the vaccines. They're still worth giving. They're still safe, but you may not mount quite as robust an immune response. The other important point, of course, is that the inactivated vaccines are safe to give during pregnancy, but in general, we advise all live vaccines during pregnancy. Most of the travel vaccines that we now use are inactivated vaccines, not live vaccines. The live vaccine, particularly that we would be very, very wary about giving when pregnant, would be yellow fever. So if you're traveling into a yellow fever zone and you've not already been vaccinated, then we would be very, very reluctant to vaccinate, and most people would not do that. But in general terms, vaccinations are presumed to be safe. The other point is the inactivated vaccines, although they're presumed to be safe, we can't put our hands on our hearts and say that large studies have been done in pregnant people. So we don't know for certain that they're as immunogenic or as safe. The assumption is, though, that they will be. We know from post-marketing surveys, for example, with hepatitis A, which has now been around since the mid-1990s, that it is a very, very safe vaccine to use in pregnancy, but there's a lot less data, post-marketing surveillance data on the typhoid vaccine, for example. But we would still give it if the risks of the disease outweighed the known risks of the vaccine. The only other point about vaccines, of course, is really, really important that the pregnant traveller is up to date with all the vaccines that we would be advising they be vaccinated for in New Zealand. So influenza, COVID and pertussis coverage.
Wonderful. Is there a website perhaps that you use and rely on for looking at travel vaccines in the pregnant traveller?
There are a number of good general travel medicine websites that have been put out by country authorities. A lot of us have traditionally always gone to the CDC site, their so-called Yellow Book or the CDC Travellers website. That gives an American perspective, and it's really important to realise that it's written by Americans for Americans, so it tends to be a little bit more conservative around things. And of course, some of the vaccines they may talk about, we may not have access here to New Zealand, or they're using different brands. So just being aware of that. And the other site that I am increasingly using now is the UK site put together by what we call NATHNAC, is the National Advisory Travel Health Committee. It's called ProMed, and there's a website for health professionals, which is free access and information for travellers as well. So the UK site, NATHNAC, and the CDC site, and there are others as well, but these are the two I tend to use, have also got good information specifically for the pregnant traveller on all aspects of travelling while pregnant. So it's a really good resource to send your travellers to, but it's also a great resource for you. The one caveat I always make around the vaccine recommendations that you see on these websites is that they're very, very generic recommendations. They will say, for example, oh, you're travelling to this country, so you may be exposed to hepatitis A, typhoid and rabies. That doesn't necessarily mean that every single traveller to that country should receive those vaccines, because you still need to make your individualised risk assessment for that traveller. But it's a good way to get a bit of a feel for the general recommendations for that country.
So, Jenny, you mentioned earlier on about malaria, and I wonder if a woman is determined to go to a malaria endemic region while she's pregnant, what advice do you give her?
I think the first question is you have to say, well, why are you going there? And sometimes, and I've seen pregnant travellers who are returning to their homeland because their parents or a parent has just been taken severely ill and they have to return to see them because this may be the only opportunity or the last opportunity they have to see them. So the general advice has to be avoid mosquito bites in the first instance. So remembering that the mosquito that transmits malaria is a night-biting mosquito. So it's just after the sun goes down and just before it comes up that are the particularly high-risk bite times, but they will continue to bite through the night. So either being indoors or screened accommodation, air-conditioned if possible, which won't always be possible, and sleeping under a bed net if you can't exclude mosquitoes from the environment. Using insect repellents on exposed skin if you're going outdoors. And a lot of research has been done on this, and most authorities now will state that certainly DEET diethyl tolbutamide, the DEET-containing repellents that have been around for a very, very long time, are very, very safe to use in pregnancy and up to tropical strength, that 30% strength or so. So insect repellents, but also covering up as best you can. The more of the skin that's covered in clothing, the less skin's exposed to bites and the smaller amount of insect repellent you need to use. So there's mosquito avoidance. Then, yes, anti-malarials. It's become a little bit difficult in New Zealand because mefloquine, with the trade name Lerium, is no longer brought into New Zealand by the pharmaceutical company, although a pharmaceutical provider has brought some in, but it becomes very expensive and it's now effectively an unregistered medication in New Zealand. So not that it makes it dangerous to prescribe, but it's just more difficult to access, because mefloquine would be my choice of anti-malarial for a pregnant person, because we have had, especially once they're beyond their first trimester, it's been around for a long time. Many countries' guidelines advocate that this is a safe drug to use through pregnancy. If we can't get hold of mefloquine, then the other two choices we have are malarone and doxycycline. And doxycycline is generally considered to be contraindicated in pregnancy because of the risk of damaging fetal development of teeth and bones. Although the Scandinavians, a number of Scandinavian countries do allow it, or it is licensed to be prescribed in the first trimester because that's before bone and teeth development occurs. But generally in New Zealand, on our data sheet, pregnancy would be considered a contraindication. So doxycycline usually would be considered not to be an option. Then malarone, which is the combination of torvaquone proguanil, while there is no evidence of harm, it has never been extensively studied in pregnancy. Many people will now use it because they consider that, yes, if you're going into a high-risk malaria area, then the known risks of malaria far outweigh any known risks of malarone. But again, it's one of those instances where we cannot say absolutely that we know that this is absolutely safe drug to take in pregnancy. So mefloquine's a possibility if you can obtain it. You need to write your prescription, get it to a pharmacy well in advance of the person traveling, because they need to order it in through the company providing it, and it can take some weeks to get to you.
So Sally asks, are there any special things that she should include in her travel medicine health kit? Obviously, she's going to have some DEET insect repellent, tropical strength if she needs that, but are there any other items that she should include?
Having a strategy to deal with traveller's diarrhea. And the most important aspect of traveller's diarrhea is maintaining hydration, oral rehydration. So I think having some sachets of oral rehydration solution would be really important for her to have in her medical kit. Loperamide, again, is one of those drugs we don't know if there's a lot of safety data or not, or around it, so possibly some would advise avoid using it. If you have severe traveller's diarrhea that is not resolving over a day or so and is getting worse, then in normal circumstances we would support the judicious use of antibiotics to treat the traveller's diarrhea. And the drug of choice now globally for low middle income countries is azithromycin, and that can be used in pregnancy. So perhaps having a detailed discussion around management of traveller's diarrhea and what drugs to use. Perhaps if she's going very remote and going further afield, a broad spectrum antibiotic for self-management of skin and chest infections and the like. And I think then just all the normal first aid items, some good Band-Aids and plasters and hand sanitizer and as you said, the insect repellent. And of course, if she's taking any routine medication, make sure she's got a good supply of those as well.
Thinking now about infectious disease prevention, what advice do we offer Sally with respect to preventing infectious diseases?
Yeah.
COVID-19, hepatitis, traveller's diarrhea.
Yeah, so it's a lot, isn't it? So all the respiratory things, so COVID and influenza, vaccination, and pertussis now, obviously. Vaccination would be your number one. I would wear a mask in crowded conditions. We've got used to wearing masks through COVID and now we've stopped using them, but you are, immunosuppressed to some degree and you could well be in crowded spaces with poor ventilation, and why not wear a mask when you're in public transport, for example. Meticulous hand washing frequently and particularly before you're eating. Carrying some hand sanitizer if you can't get to a water and soap source. All the food and waterborne illnesses, as I mentioned, with traveller's diarrhea, just being extra careful about food choices. Of course, in pregnancy, even if you weren't travelling, there's all those added foods that we avoid because of the listeria risk, and that's going to be even more important in low-income countries where the chance that dairy products, if they're available, pasteurized is less, it's more likely they won't be pasteurized. Food and water, all the insect-borne diseases. So we mentioned about the malaria-carrying mosquitoes, but actually the biggest risk from mosquito bites for all our travellers globally at the moment is not malaria. Dengue fever is a far greater risk. There's this season, globally, there has just been a huge expansion in the number of cases being reported, and the geographical spread is increasing with global warming. We're seeing mosquitoes capable of transmitting dengue move up mountains and move into parts of the country where they've never been before. And of course, dengue is transmitted by a day-biting mosquito, which is also adapted very well to urban environments, including resorts and hotels and cities. So this is not a rural disease. You can catch dengue in Singapore, and it's much harder when you're out and about all day to protect yourself from mosquito bites. But you may be lucky and you may not see a mosquito bite the whole time that you're traveling, but you've got to be prepared when you're going to any tropical, subtropical areas. So again, it's covering up as best you can and using repellents. And I didn't mention it before, but there is some evidence that pregnant people are more attractive to mosquito bites because you're vasodilated, so you're exuding more heat, but also other pheromones and things that are attractive to insects. So double up on all those insect prevention measures. The other thing that's really important with regards to food and water is there's one hepatitis virus, hepatitis E, and that is contracted through contaminated food and water. And if you catch this while pregnant, some studies have shown up to a 50% miscarriage rate. So it's devastating in pregnancy. And that's, again, it's so through food and water. So being absolutely meticulous about everything you eat and drink, all the advice we always give, don't trust tap water, make sure every bit of water is boiled or bottled, canned or bottled drinks, and food, trying to stick to cooked foods that are freshly prepared and served piping hot. It's not a guarantee. We know that you can't control everything in restaurants, but you can try and minimize your risk of traveller's diarrhea through good food choices.
So you mentioned some ways to get safe water, but that's not always available. So can you use purifying tablets, and what about iodine-containing purifying methods when you're pregnant?
Yeah, so bottled water, and I know there are always lots of stories about have they been unscrewed and filled with tap water or whatever, but most places now, you're breaking the seal and you consider that to be safe. Boiling your water and just bringing it up to a rolling boil and leaving it cool enough to drink. If you want to, you can boil it beyond the rolling boil for up to a minute to make absolutely certain that you've killed everything. But then, yes, there are water purification methods, and traditionally it's been the halogens, it's chlorine and iodine. The concern with iodine is if while you're pregnant, if you've taken too high a dose of iodine, then that can somewhat ironically cause congenital hypothyroidism because you've loaded the baby's thyroid with iodine, and that switches off thyroid hormone production, so the baby can be born hypothyroid. We don't know what the safe limit is, and it is important that you have some iodine through your pregnancy. And if you were somewhere for a day or two and you had some iodine and that was all you had, I'm sure it would be fine, but you shouldn't use it for weeks and weeks on end as your prime chemical for treating water. But in New Zealand, it's not that much of an issue anymore because the water purification tablets that you can buy here to take traveling, most of them are chlorine-based or chlorine dioxide-based, and they don't have the same concerns. In the EU, iodine products have now been banned, so not as many are being manufactured as there used to be. So iodine, avoid it if you can, and if you do have to use it, only use it for a very short period of time. The chlorine tablets are safe to use. The other option for water purification now is using various water purifying devices, and there are various filters and the like on the market, and many of them now get viruses as well, so they're always a good option to look at too.
So, specific environmental issues at the destination, something that all travellers should concern, but what advice do you give about air quality, temperature extremes, and altitude?
Air quality is a problem for everybody. If you're a bit more uncomfortable with pregnancy, then it may have a bigger impact on, and of course you're concerned about, could this have any impact on the developing baby as well. I think that comes down to your pre-travel preparation, thinking about where you're going, do a bit of homework. Many destinations that have very poor air quality, it is a seasonal thing, although you can't guarantee that, but there might be particular times of the year that it's going to be worse than other times. Again, once there, if it is particularly polluted, then you could just use a standard mask. Whether or not that has a huge impact on the finer particles, we're not too certain. But air quality, we know globally, is deteriorating, particularly in these huge megacities, and that should perhaps be something to take into consideration when you're making your plans. As I mentioned with heat, there is some evidence that you're more prone to heat illness and overheating when pregnant. So again, trying to avoid extreme temperatures or destinations with extreme temperatures at the warmer times of the year. Better to go in spring than the height of summer. Keep well hydrated, because we know the main mechanism our body uses to keep ourselves cool is sweating, and you can only sweat if you're well hydrated. And when you become dehydrated, you can't sweat, and that's when you start heating up. Altitude, the American College of Obstetricians and Gynecologists have put out some general guidelines, but they're very, very conservative, and they basically say if pregnant, you shouldn't be traveling, I think it was above about 2,000 meters or so, which many people would consider quite conservative. It's not the altitude itself that is necessarily the problem. It's just that a lot of the high altitude destinations that people go to, travelers go to, they're also isolated. They're high up in the Andes or in the Himalayas, and they're in low-income countries with poor antenatal services. So it's a combination of the altitude and where the altitude is. If you're going on a driving holiday through Canada or the United States, for example, and you drive to the top of a ski field and spend a day sitting there and then come back down again, that's unlikely to be of any great concern. But if you're planning to go trekking to Everest Base Camp, for example, while pregnant, I mean, that's enough of a challenge not pregnant, let alone while you are. And if, heaven forbid, there were to be some medical emergency, you'd have to think about exit routes and the like. If the pregnant person has a lot of experience, outdoor experience, and the activity that they're planning to undertake while they're traveling are activities they've had a lot of experience in the past, then that makes me feel a lot more comfortable, because they're fit for that, or they have an appreciation of the physical demands of that activity. We would certainly advise against extreme altitude, but probably sticking in around the 2.5 to 3,000 meter altitude for most pregnant persons, provided this is a normal pregnancy with a good no placental insufficiency, should not be a major issue. But it's thinking about the remoteness that is more important.
Are there any special considerations that pregnant people should take with respect to choosing their mode of travel?
Well, with flying, we, even in commercial airlines, there is some hypoxia but again, in a normal pregnancy without any placental insufficiency, that shouldn't be a problem at all. You should be able to compensate. The risk of prolonged seated immobility, whether that be in a plane or a train or in a car, is a risk factor for deep vein thrombosis, venous thromboembolism. And we know that pregnancy, your blood is a bit thicker and viscous, so you're a bit more prone to those anyway. So I would recommend thinking about getting well-fitted, properly fitted below-knee compression socks, travel socks, to help with venous return, and some simple exercises. We're a bit reluctant to tell people to get up and move around in the plane at the moment, given all the recent problems with a few high-profile turbulence reports. So hydration's important, mobility. If you can't get out of the seat, then just doing some leg exercises in the feet, anything that contracts the calf muscle will help with venous return and hopefully reduce the risk. Possibly, if I had an option between a slightly longer train journey and a shorter flight, I'd probably opt for the train journey because it is easier to get up and move around and reduce that risk. Traveling by car, obviously, you would follow all the road rules that you would follow here. One of the problems in many less developed countries is the availability of seat belts. And even if it's a legal requirement, it isn't always enforced. And I'd feel vulnerable enough non-pregnant traveling in a car without a seat belt, but it would be doubly vulnerable if you were also pregnant. I'm not saying don't travel in cars, but again, it's just one of those other little things that you need to think about before you embark on travel to a low-income country while pregnant.
Fantastic. Jenny, to conclude our podcast today, please, your take-home messages.
My take-home messages are, by definition, pregnant travellers need to be aware that they are immunocompromised to some degree, even if they're really healthy people and young healthy people. They will be more prone to certain infections, and they may have a worse outcome if they do contract a number of infections. We can't offer the same degree of protection for the vaccine-preventable diseases for pregnant people than we can for other persons, because it may not induce as robust an immune response, and there are some vaccines that are contraindicated. But if you think through the risks and talk to somebody, we can make travel as safe as we possibly can. And I think very, very important to ensure you have travel insurance, and as I said before, that it also covers the neonate.
Wonderful. Well, thank you for your time today, Jenny. It's been wonderful chatting to you. If you're a New Zealand GP and would like to claim CPD points for listening to this podcast, our podcasts are eligible, so please log them. You'll also find a list of resources that Jenny and I use to make this podcast on our website, goodfellowunit.org. Thanks for joining us today.